डॉक्टर कहीं गई चले जाएंगे.
Hello.
Yeah, I think we are ready now.
Yeah, sure.
Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma. It's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a problem of middle age when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided. Today, we have with us Dr. Dyuti Das, is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS MD, specializes in dermatology, cosmetology, and trichology. Currently, she is practicing as consultant dermatology at Vohra Skin Clinic, Kolkata. Dr. Das has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Das is aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Das, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Hello. Good morning.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So today we are going to talk about hair care in current scenario. So whenever we talk about hair care in current scenario, the first and the foremost common problem which is faced by all of us is like irrespective of gender and age is the hair loss. So can you please enlighten us with your profound experience? What is hair loss and is it different from hair fall?
So, we all face some amount of hair fall in our daily lives, which is normal. But we should differentiate it from hair loss. That is when we see some amount of scalp visible through our hair. So that is something that should be alarmed about. And hair fall is something that we call as hair shedding. It's about 50 hair is normal per day, but if it is more than that, 50 to 100, then it is something to be worried about.
Okay, doctor. So, doctor, are there any alarm sign कि hair fall is normal or not normal और अभी डॉक्टर को जाना चाहिए or not?
As I said, we all shed few hairs during the day, which is normal. 50 to 100 strands per day is a normal hair fall for any person. If it is more than 100 per day, then yes, it is slightly alarming and then you should go to your doctor.
Okay, so more than 100 is considered as like little alarming and we should
Normal.
visit to.
50 to 100 is okay.
Okay, okay, quite interesting, doctor. So now that we know that what is hair loss and hair fall, so like doctor, one thing which make us very irritating, like why, क्यों हो रहा है ये? What are the causes? So can you please enlighten like what are the causes of hair fall versus hair loss?
The most common cause of hair loss or balding is the
Mhm.
genetic component or male pattern baldness. It is something that you inherit from your parents and it is in your genes. You
Mhm.
start seeing your scalp getting wider in your early teens, around 20s. The second most common that people get worried about is increased hair fall or hair shedding that we call as telogen effluvium. In that, you see about 200 to 300 hair fall per day, and it may be triggered by some recent illness or stress that you may have. Hello.
Yeah,
And
yeah,
apart
doctor.
from these, we also have apart
Yeah.
from these two common conditions, we also have another condition which is immune related called the alopecia areata, where we have bald patches on our scalp, but it is completely treatable.
Okay, okay. So the treatment is available and it is not to worry kind of or lack of confidence sitting at home कि क्या करे क्या करे. It's better to visit the doctor.
Yes.
So, doctor, like nowadays we all are, living a lifestyle which is very busy, and we like no time to sleep, no time to eat. So, does this diet play any role in managing hair fall?
Yes, diet and lifestyle plays a very important role in managing and having healthy hair. So the
Mm-hmm.
first step is that you should have a very good balanced diet which has right amount of calories, proteins and vitamins and supplements such as iron and amino acids and
Mm-hmm.
omega-3 fatty acids. It helps in making your hair healthy and obviously reduces your hair fall. And according to lifestyle changes, stress is very bad for hair. If you have a very
Mm-hmm.
stressful lifestyle, it will amount to some amount of hair fall in your daily life.
Okay, quite interesting, doctor. So, doctor, like, okay, the diet is important. We know the alarm sign also. So, can we test like that? Are there any tests for hair fall? Is there any investigation required for hair fall?
If your hair fall is like too much, then no need to get alarmed. As I have said, it may be a condition called telogen effluvium. It might be due to some illness that you have suffered in the last 6 months, like malaria or typhoid. It is
Mm-hmm.
completely recoverable, so nothing to worry. But
Mm-hmm.
however, if you have any underlying hormonal conditions such as polycystic ovarian disease or
Mm-hmm.
hypothyroidism, it also contributes to hair fall and hair loss. In that case, you may need to get yourself checked and get the relevant testing done.
Okay, okay. So, doctor, like investigations are there, and we can go to the doctor. And if we are facing like more than a month or something hair fall, we should visit to the doctor. So, is it hair fall is manageable at home, and if it is, or with doctor, or how to manage hair fall? Like it's like very tricky thing that we get irritated, the patient get irritated कि यार ये गिरे जा रहा है, what to do, so how to manage hair fall.
So if you are noticing hair fall for quite a long time and it is not reducing, the first thing would be to seek that if you have any kind of underlying disease or not, such as I have said, thyroid disorder, anemia, and any other
Mhm,
nutritional deficiencies. So
mhm,
your diet is the first thing that you should check. If you're
mhm,
having a balanced diet, your hair will take care of itself. Second thing
mhm,
that you should check is that you should having a proper sleep cycle, adequate hydration, and of course adequate rest. These three things are very important not only for your hair but also for your skin.
okay, okay. So doctor, now that we know the what is hair loss, how to manage it, what investigations are there, there is one word called PRP getting lot of like a lot of focus. Like everyone is talking about PRP. Ki PRP is very good for hair fall or hair loss. So what is PRP exactly? And should people go for it?
PRP or pituitary rich plasma therapy is one of the newer managements for treating hair loss or baldness. What we do basically is we draw your blood and we separate the plasma from it, and it contains platelet concentrates. These platelet concentrates have a very large amount of growth factors which we inject directly into the thinning areas. Here they stimulate your hair growth. This is what PRP is about, and yes, it works wonderfully on people who have receding hairline, along with obviously some medications, topical medications and oral medications.
Okay, okay, quite interesting. Now, my favorite part, doctor, can you please give us some important healthy tips for a healthy hair?
Okay. The first thing that I should say, I have already discussed, focus on your diet. Make sure that it is rich in biotin. If you can also take some supplements, it's also okay, which is rich in vitamins, biotin, iron, and a right amount of amino acids. Second thing is to take off your hair if you are a woman. If you have long hair, go easy on the heating tools. If you use your heating tools regularly, the hair will go dry and brittle and they break easily, and that will result in hair fall.
Mhm,
Use it sparingly, like after a heat protectant spray. Do not use it too often. Do not
mhm,
use too hot water on your hair, that also damages your hair.
mhm,
And try to trim your hair regularly because split ends will also cause breakage and hair fall. And last
mhm,
but not the least, have a very healthy work life balance. Try to
mhm.
manage your stress and have a very stress-free lifestyle. The hair will look healthy and glowing. And if you have
Okay,
any
thank.
underlying disorder, kindly get it checked out.
Okay, so life balance is very important, and I think it's a very good message from the doctor. So, doctor, this discussion was very informative. I'm sure our viewers have found the session very helpful. So, doctor, can you take one or two live audience question, please, because they are asking many questions. So, can I take one or two?
Sure, sure.
Yeah. Hello, doctor. I'm also from Kolkata. How to get your appointment? And I'm facing androgenic alopecia. I have visited many doctors. They have given me so many vitamins and minerals. Do I need to take them for whole life, or is there any other solution for my androgenic alopecia?
Hi. So if you are suffering from androgenetic alopecia, the key medication to controlling your hair growth is topical minoxidil. If you are applying it regularly, it will help to maintain your growth. But along with that, you may need PRP sessions as well.
Okay, and he can take your appointment through Google, searching your clinic name.
Yeah, you can get you my appointment through Librate or Practo.
Okay. Okay. Another question from the audience is, Doctor, I'm 51 years old and I've reached my menopause. And after my menopause, I'm facing lot of hair fall. My neighbor told me that hormone therapy and PRP can help me out. So is it true? Can I come?
Hello. So if you are postmenopausal, it is very normal to face some amount of hair loss. As I have already discussed, hormonal imbalances do cause hair fall. But I would suggest to give it some time. Within 6 months to 1 year, they might go away on its own. If you are still facing hair fall, then yes, you can surely go to your dermatologist or doctor, and if possible, get the proper treatment and PRP if needed.
Okay. So the women who are at a menopause age, they also face hair fall.
Any kind of hormonal imbalance very fast will cause some amount of hair fall initially, but they eventually become normal.
Okay, okay, quite interesting, doctor. Another question from our audience is, hi, doctor. My daughter is just 12 years old and she has lot of gray hairs. I don't know why she's having gray hairs at such a young age. Is there any way to stop it or reverse it?
So the cause of gray hair or kernitis is mainly two. If you have inherited it from your parents, it may be
Mm-hmm.
genetic. So if the child's mother or father has also history of early graying, then the child may get that. Then it has nothing to worry. We cannot do anything about it.
Mm-hmm.
However, if the parents have a history of thyroid disorder, then the child should also get checked because having thyroid is one of the causes of getting early graying.
Okay, okay, quite interesting. Now I'll quickly take the last question from our audience. Even I want to know, doctor, आपकी skin इतनी clean और इतनी glowing कैसी है? What's your skincare regime? And I also want hair like you. What to do?
Okay, thank you so much for your kind words. Actually, being a dermatologist, I stay away from mostly chemicals and makeup on my skin. I try to stay as natural as possible. So my basic skincare includes moisturizer, sunscreen, and a nighttime serum, which may contain some amount of retinol in it. And
Okay.
regarding my hair, I also keep it natural. I may blow dry if required for some occasions, but that's it. I keep it natural.
Okay, so keeping natural is the formula. Okay, doctor. Thank you so much, doctor. Would you like to give any take-home message or any other suggestion to our viewers today?
Yes, take care of your diet, take care of your lifestyle, and if you are facing with any kind of hair loss or extreme hair fall, do not worry and please get an appointment with your closest dermatologist. Thank you.
So yeah, while we can lead to more hair fall, instead of that, we should visit to our doctor. Thank you so much, doctor, for sharing so much information and all your expertise with us today and answering all the questions of our viewers today. I'm sure our viewers have found the session very beneficial and very helpful. And thank you, doctor. It was delight to have you, and thank you so much for your valuable time.
Thank you so much.
Thank you, ladies and gentlemen, for participating so actively with us and asking so many questions. I know I could not have taken all the questions, but yes, we'll take appointment of doctor once again to answer those questions and also with a new topic for an awareness. So thank you, doctor, for this time. Let's sign off for today. Thank you, doctor. Thank you so much. Have a
Okay,
nice day. Bye bye.
thank you. Bye.